It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Dogs Network, featuring some of the best physicians in the Dallas-Fort Worth area that are changing people's lives. And happy holidays. We hope you're enjoying your holiday season.
Yes, happy holidays, everyone. And Candace, let's begin the show with world-renowned doctor, Dr. Clay Cockerell. He talks about skin conditions common with active people.
Yeah, we tend to think of athletes as being healthy people. They're out running or lifting weights or wrestling or whatever they do. But surprisingly, there are a number of conditions that are more prone to develop in athletes, depending upon what kind of sport they engage in. One of the reasons is they may be in an environment where they're very close to other people that may be carrying a bacterium, for example, like staph, so they're prone to get boils and sometimes cellulitis and folliculitis. So that's one thing that can happen. There's also sometimes herpes virus infections, especially in wrestlers. There's a type of herpes called herpes gladiatorum, which is due to their touching one another in a wrestling match, and one spreads the herpes to another one. Fungal infections too. They get hot, sweaty. The skin, especially in runners or people that are in hot, warm environments, the skin chafes, and then fungus can set up shop there. They can get a yeast infection or can get so-called jock itch, which is due to ringworm type of fungi. So those are all things that we see fairly commonly in athletes. Yeah, athletes can protect themselves if they use careful skin hygiene. So in other words, for wrestlers, for example, they need to make sure that they use a good antibacterial type of wash very frequently, especially after they've wrestled and ideally before they wrestle. So if the wrestlers are all doing this together and they're keeping the gym clean and all this kind of stuff, the chance of spreading those kind of infections is certainly less. As far as trying to prevent things like ringworm, it's good when you're getting hot and sweaty, to let that area kind of cool down, take a cool shower, let the area air dry so that it doesn't really just stay hot and macerated and whatnot. You think you might have one of these infections, athlete's foot or jock itch or whatever, probably the first thing you can do is maybe just try something over the counter. There are things like antifungal preparations that you can buy at the pharmacy. If it's not getting better within about a week or so, probably ought to call it to the attention of your dermatologist, have them take a look at it. They can do a scraping or possibly even a skin biopsy. Even though in a young individual that's got the predisposing factors, that's going to be by far the most common cause. There are some other things sometimes that can look like fungal infections that are more serious. So you wouldn't want to let it go too long if it didn't respond pretty quickly to treatment.
Bonnie has a beautiful baby girl, and she credits obstetrician Patrick Allen for possibly saving her life. To find out more on Bonnie's story and other life-changing stories, log on to bestdocsnetwork.com.
I woke up on a Sunday morning and I had this awful pain. And it was like I was hurting everywhere. But I knew it was like my head and my balance. I couldn't get my balance. So I told my wife, I don't feel good. I think you need to take me to the hospital. Went in and a surgeon on duty examined me, and they gave me CAT scans, and when she told me that she saw a mass in my head that weren't supposed to be there, and she couldn't tell me exactly what it was, but she wanted me to see a neurologist.
He was having some problems with not only headaches, but not being himself too. Ultimately, he got seen by a neurologist who did an MRI, who discovered the very large tumor, and he was placed on seizure medications and referred to me for resection of his tumor.
Yeah, you got a big one there. She said, but we can handle this, you're gonna be okay. And she started drawing. She drew my skull, and she drew where the tumor was, and she just went to work, and she drew that entire table with pictures of how she was gonna go in and cut it and get it out.
It was very unusual for us to find one that large and that had been that locally destructive of so much of his tissue that it ended up requiring so much more in terms of reconstruction. Because it was not only just the resection of the tumor that was so important in him, but we needed to give him back normal contours so that he looked normal in public after the surgery.
Knowing that she was confident and she knew what she was doing and everything she told me, that's the way it came out.
And he's been doing very well for many years now. We've never seen any signs of any residual tumor. He sees us about once a year and is doing very well and enjoying a very active lifestyle and enjoying his retirement.
I'm blessed. And every day when I wake up, I think about her. She did it, you know. That is, that's my way of telling it. Here we are 7.5 years later, you know. That's my best buddy.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com. The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
Don't forget, for more information on any of the outstanding doctors you see on the show, head to the website. It's bestdocsnetwork.com, bestdocsnetwork.com. Right now, time to head for our next doctor. It is anesthesiologist and pain management specialist, Dr. A.L. Shaw.
I came to see Dr. Shaw. I'd had 2 surgeries already, both failed. The first was a laminectomy after injury at work, and the second was a fusion. And after the second operation, the surgeon had pretty much done his part and felt like I should be pain-free. So our discussion was, I don't feel very well, I'm still hurting, and he said, you shouldn't be, I've done the surgery. So that's sort of how we left it. So then I went looking for a pain specialist.
Many of our patients referred by primary care doctors or internists have back pain. Some have not had back operations. Some have had 1 or more back operations. And we spend a substantial amount of our time caring for people that have had previous spinal surgery and are the same or worse after their spinal surgery.
The first consultation with Dr. Shaw, we talked about what are the choices other than surgery. So rehabilitation was one, injections were one to the area that was been affected, and then a host of medications. And so we really set off on a multi-tiered approach to deal with all of those things.
With Mike, he was in such discomfort that he could not perform his job well. Had he given me extra time prior to his 3rd spinal operation, I believe that he would have been better off quite more rapidly than we've been able to achieve after his 3rd spinal operation.
One of the things that I really like about working with Dr. Shaw is that we're able to set up some type of goal when I came to see him in the practice initially. I want to be free from the pain, free from the medication. And so pain freedom is a big deal to me, and it's a big deal to Dr. Shaw.
If one sticks with the conservative model first and then goes to the more invasive model, you don't burn any bridges to trying to feel the best you can be as soon as you can get there. Sometimes when we reverse those actions, it slows down or intensifies your recovery. And perhaps, in Michael's case, you don't achieve all of the goals that you could have achieved had you not had the procedure, that is, the operation.
Alcohol has some good and some bad to it. The good is that they say that red wine prevents some heart disease, and I think that's true. It helps reduce the amount of LDL cholesterol, the bad cholesterol, and increase the amount of HDL, which is the good cholesterol. There are downsides to alcohol, though, also. There's a lot of alcoholism in this country that we don't appreciate. Many people are alcoholics and don't even know it because they function so well. You don't have to be sleeping in an alley to be an alcoholic. One question you should ask yourself to see if you have alcoholism is, have there been many times in the past year when you have drank more than 5 drinks in a day as a man, or more than 4 drinks in a day if you're a woman? The general recommendation for alcohol intake is that men can safely get away with 1 to 2 drinks a day and women 1/2 to 1 drink a day. this may be good for you in some ways, and if you stay under that limit, you won't get into the bad level. You ought to check with your doctor on this and ask him or her about that, especially if you have a family history of alcoholism.
Before coming to see Dr. Wallace, I'd had implants, and my implants were put in or finished by May 1989. And all of a sudden, in February of 2011, the top went south. I knew the implant was loose and it hurt, and my dentist, of course, recommended Dr. Wallace.
Shirley came to us with a little concern. She had had a lot of dentistry done in the past, and she had actually had implants years ago. They had replaced several teeth. She had very big bridges, and they were getting loose, and she knew that there was a problem. She was having some pain.
The way they're doing it now, all Dr. Wallace did was pull the teeth, put the implants in, and you get teeth same day.
We saw Shirley, and immediately we knew we needed to move forward with an EverSmile procedure for her. This gave us the ability to remove all the remaining teeth that were bad. Once we had that done, we were able to place implants and give her a whole new smile the same day. She was ecstatic.
My friends don't even know. They knew that I went through it. They're just amazed how pretty my teeth are.
So when Shirley came in, we got a 3D CT scan. We evaluated the remaining bone and the teeth and decided the EverSmile was the perfect procedure for her. She came in for surgery. We removed all the bad teeth. We put in all new implants, gave her a whole new set of teeth. And I tell you what, within minutes of waking up, she's in the mirror, she's ready to go. She is, again, going a million miles an hour. And the EverSmile that we gave her is probably the only thing that's going to be able to keep up with her.
But I mean, I was up and at 'em. I had it done on Thursday, and I was back playing bridge on Monday.
So now we combine the success rate of implants, which is single-handedly the most successful form of dentistry we have. We use that type of technology, the latest and most advanced imaging and planning techniques, and give her a new EverSmile. It's highly successful. It goes in the same day. It's exactly the teeth she wanted. You can't do that with anything else in dentistry. It's amazing.
I began experiencing lower back pain in June of 2010. In my industry as a chiropractor, I didn't seek conservative care until about November of 2010. And at that point I was so bad that conservative management wasn't going to work for me because I just couldn't relax enough.
One of the pathologies that causes low back pain and leg pain is something called the spondylolisthesis. And what spondylolisthesis means is slipped vertebral body. And what that does is it causes malalignment in the vertebral spine alignment, and it also makes the canal smaller. If you look at this from the top and look at the canal, this is where your nerves go. But if I allow one of the vertebral bodies to slide forward like this, you notice the canal gets smaller, and that actually pinches on the nerves and causes leg pain.
In March of 2011, I guess it was, had surgery with Dr. Miles, took a 5th lumbar disc out. They also went in and supplemented the stability of the lumbar spine with some screws that they put into the vertebrae. Felt wonderful. I was probably 80% better after the surgery.
Jarrett came in with back and leg pain. It was very severe, and because of Jarrett being a chiropractor, he took care of it himself most of the time. So what we did in his situation is we basically opened up the canal. I placed a cage inside the disc and then brought this piece of his spondylolisthesis back into a normal alignment. Then I placed screws in here to hold everything stable, and that allows this to fuse and become a solid joint. And that got rid of his leg pain and got rid of his back pain.
The post-surgical status of me right now is I've never felt as good as I feel. I've always thought of all health professions having a necessary place. Me being in the health field, I put it off too long before I actually sought a more invasive route.
Dr. Armstrong has a very physically demanding job. What we needed to do for him was to achieve pain freedom for him, and we made his back pain history.
Don't forget, for more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. Of course, Candace, the #1 video source as far as educating the public.
Yes, and up next is prosthodontist Dr. David McFadden.
I had a bad problem of grinding my teeth. And 30 years ago, I had some beautiful teeth. And, you know, they slowly got worse and worse and worse. And then, of course, I started having cavity problems. And my regular dentist told me, look, they're not going to last your lifetime. So you're faced with either dentures or you know, redoing your mouth.
Many patients find us because they're at the end of the road on their dental history. They have neglected their teeth, or they've had habits that have caused their teeth to wear down to the point where they know they have to do something. And they present sometimes after many decades of problems, and they're ready now to fix those problems the best they can afford to. A lot of the patients fall into the full mouth reconstruction category, which means they need every tooth in their mouth addressed in their treatment.
When I finally went to Dr. McFadden, I was looking to him for a permanent solution and something that would last the rest of my life, obviously. And then calmly brought me into his office and literally wrote down on a piece of paper, here are 3 different proposals. After weighing it, I decided to take the highest cost option for me, which was to put crowns on every tooth.
When Bob came to the practice, it was a really fun appointment. He was instantly charming and fun to be around, and we became friends throughout his treatment. When Bob arrived, he had had 4 decades of tooth grinding and ended up with almost no tooth structure left, and his wife hated his smile. We were able to use all of his teeth and perform certain procedures to allow him to keep his natural teeth and improve the way they look through crown treatment. One of the funniest things about Bob is that he carries his before and after pictures on his iPhone. He shows everybody. He shows people that don't care at all what his teeth look like and how great his teeth look now.
He cares, incredibly cares, how good your teeth are. A little bit obsessive compulsive he is, but it works out in your mouth to be beautiful.
Bonnie has a beautiful baby girl, and she credits obstetrician Patrick Allen for possibly saving her life. To find out more on Bonnie's story and other life-changing stories, log on to bestdocsnetwork.com.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
When patients come in to see me to talk about pain management, one of the first things we're going to talk about is how are they managing their pain. If they're in pain, then they're not going to have a good quality of life. That's why I became a pain management physician, return patients to a better quality of life and give them pain freedom. The first treatment process, it really is just listening and then educating and then physical exam. Oftentimes we're taking some x-rays to make sure how much arthritis a patient may have, if they had any previous fractures. And sometimes, especially with the back or the neck, they may have had a fracture and we're never told. Then we'll talk about if we need to do any more further imaging, some more complex imaging, or if we have to do any electrical studies to find out if they have any nerve damage. We'll talk about if they have any instability, and then we'll talk about how we correct and treat that. There's so many medications, it just runs the gamut. There are over-the-counter anti-inflammatories, which are fine. There are prescribed anti-inflammatories, mild narcotics, heavier narcotics, neuromodulating medications or medications that decrease the irritability of nerves, different medications that are transdermal, they go through the skin, that can help out with some of their pain as well. So it's sort of a rainbow of different medications that we can give. Oftentimes, patients will be taking medications and they can become frustrated with that, and they're looking for something that lasts longer, and that's when we start talking about doing injections for them, epidural injections, nerve blocks, facet injections, and that can help out with decreasing their pain for a longer period of time. While somewhat more invasive, it's still very, very safe, very fast to do, and can give up to weeks to months of relief. Our ultimate goal is to give people pain freedom to go out about and do their normal activities and really enjoy life again.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area. The Best Docs Network features some of the best physicians in the Dallas-Fort Worth area that are helping to change people's lives, like our next doctor, plastic surgeon, Dr. David Azus.
A couple of years ago, I decided that I needed to make some lifestyle changes, and I lost about 50 pounds and just started to get healthier, and I started feeling so much better, and I decided that I really didn't look as well as I felt.
Donna's a very attractive woman. I think she has beautiful bone structure. Although she does not dye her hair and she has white hair, she has a very elegant look. But I think she had very prominent jowls. She had an obtuse cerviconuchal angle, which means that her neck went from her chin down straight, which you could see in her preoperative photography.
I didn't want to look like a 25-year-old. I just wanted to look like my well self. He did my eyes, underneath my eyes, the bags under my eyes, which really made such a huge difference. And, you know, pulled up the neck and, you know, so that this is really clean in here. And I had, with the weight loss, I had a lot of hanging skin, and he, you know, took that away, so that was wonderful.
Afterwards, she looks natural. She just looks a lot younger and a lot better. I mean, people I don't think would believe that she was in her mid-60s.
As of right now, I'm about 6 months post-op. I'm thrilled with it. I really am. It looks natural. It doesn't look pulled. I look now like I feel.
So overall, you have a very natural and refreshed look. You look like you've been vacationing or you're well rested, and people know you look a lot better, they just can't place it.
You really have to be comfortable with the doctor that you're going to. He answered every question that I had, didn't hesitate to say, if you change your mind the morning of the surgery, it's no big deal. It's up to you. You know, nobody's pressuring you. So I just felt comfortable with him.
Raymond, a loving father of 3, had sleep apnea. At times, he stopped breathing at night until he met Dr. Trone. To find out more about Raymond's story and other life-changing stories, log on to bestdocsnetwork.com.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Hannah was born with a traumatic birth injury. It was an incredibly long labor, it lasted a long time, and in the end she suffered a hypoxic brain injury and a stroke. We found Texas Sports Hyperbarics when we were on a search of a number of different therapies for her to help her rehabilitation. We were very lucky that we had a physician friend of ours say to us that if you are looking for the height of human performance and help for your daughter, the best thing to do is to see what researchers are doing.
Hyperbaric oxygen treatment is taking a patient, putting them in a chamber, and exposing them for a specific period of time. We flood the chamber with oxygen at a higher pressure, usually 1.5 or 1.5 times the atmospheric pressure to 2 times the atmospheric pressure for 60 minutes. And then we do this 5 days in a row, and typically for 3 or 4 weeks for a total of 20 treatments. to increase the oxygen in their tissues throughout their body.
The effects of the diving for the hyperbaric treatments for her has been that she has been much more relaxed. Her resting state is much better. Her demeanor is much better. It allows her to be much more alert. She's become much more vocal, and her response time to questions is much faster.
She's more cooperative, and just have seen a huge improvement in her overall level of function compared to where we started several months ago. Our hyperbaric technician will look in their ears to make sure that they don't have any ear infections or that they can clear their ears. They'll listen to your lungs and make sure there's no wheezing or evidence of a lung infection. Then you lie on the bed that slides into the chamber's closed, and we gradually increase the pressure in the chamber with 100% oxygen and raise the pressure from 1 atmosphere, where we're all living, to 2 atmospheres, or roughly 30 pounds per square inch.
Any parent of a special needs child should investigate the clinical information behind hyperbaric medicine, and that if they were looking for a place to come and bring their children for treatment, that Texas Sports Hyperbaric would definitely be a place they should consider.
I had no energy. I was limp. I just barely could put one foot in front of the other. Every day was just a difficult day to get through. All I wanted to do was just to crawl into bed. I was so tired. I was also having some heart palpitations and flutters, and that was scary. I could tell something was wrong. So I went and saw Dr. Worrell.
Sleep apnea is really sleep apnea with hypopneas. There are 2 different parameters we look at when we're doing sleep studies as far as sleep disordered breathing. There's the pause in the breathing for 10 seconds, which constitutes an apneic episode. In a hypopnea, you don't breathe well enough to get proper ventilation and your oxygen level actually drops. So for people who every 2 minutes don't breathe well enough to ventilate their body, then we call that a severe sleep apnea. Severe sleep apnea is associated with various kinds of heart problems.
Dr. Worrell suspected that I probably had a form of sleep apnea, and he prescribed a sleep clinic, and it came back that I was borderline. So we waited for a little while more and did another one, and finally it came back that I was full-blown sleep apnea. And they of course said, you've got to have a machine.
A CPAP is kind of a necessary evil sometimes. Some people will adapt more easily than others, and for those who do adapt to it, they are the ones who are the most appreciative because they see the quality of life improvement. They wake up and they're not so achy, not so stiff in the morning, that they have more energy, more stamina, that they just feel better overall.
Within 2 weeks of getting a good night's sleep with a CPAP machine, I was back to 100%. I was like, it's a miracle. It's just absolutely a miracle. I think Dr. Worrell is probably the best doctor I have ever gone to. He partners with you for your health issues. He's not condescending. He listens and very, very gently pushes you in the right directions that you need to go for your health.
Well, that'll do it, everyone. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that are changing people's lives.
And for more information on any of these great doctors, of course, head to the website, bestdocsnetwork.com, the #1 video source as far as educating the public.
And don't forget to stay tuned for our Best Docs Network featuring Forest Park Medical Center, which is coming up next.
And let's let everybody know, if you have a question or comment for us, send us an email on info@bestdocsnetwork.com. Happy holidays. We'll see you next week.